assistants, more often than I see the actual physician.
Right.
I know the physician can be involved at the point where he needs to be or she needs to be, but I think it's a neat thing. I think it's real good for our society in general, especially as we have the aging population. And I don't know. I get the feeling that the nurses, and I don't know whether it's because of the training or the mindset. I just get the feeling that you pay a little more attention or spend a little more time with the patients. Is that designed into the training?
Well, I think it's designed into the nursing model of healthcare in general.
Yes, absolutely. I just wanted to interject because I think you brought up a very important point that the nurse practice education that we get is much more geared toward educating the patient about being healthy and doing preventive things to keep them healthy, whereas the medical model may be towards addressing a disease that has already occurred. NPs generally want to come from the other direction, and so that does take more time to spend with the patient. However, we're not actually reimbursed for that time.
Right.
But I think it's understood that the TLC comes from your department, and the bedside manner. Doctors are not expected to do that. In fact, it's kind of an anomaly when a doctor has good bedside manner. Everybody marvels.
I know, isn't it?
Yeah, and I realize they have a lot on their minds, and they're very, very busy, and they're trying to cram as much into the day or as many patients as they can into the day. I like the fact that general practitioners' offices, all doctors.
What would be the most effective means to educate the public about the role of the advanced practice nurse?
Programs like this. I think a lot of people in business in general don't realize how accessible they can make themselves on radio talk shows. Radio talk is the most influential form of media that exists. Period. That's why Congress tried to control it a few years back. They realized how influential it was when it came to campaigning.
Sure.
And you can get on talk shows like this for nominal fees. People are always surprised at how easily they can engage themselves in a regular talk show here on Chasm. And they always say, gee, I thought it was more expensive than that. And it's not. And in fact, it's a great deal cheaper when you think of the numbers of people you're reaching and how you can project not just a thought or an idea, but a personality with.
That's great. Yeah. All right, and the last question we have for you is, what would be the most effective means to educate the public about the role of the advanced practice nurse?
Programs like this. I think a lot of people in business in general don't realize how accessible they can make themselves on radio talk shows. Radio talk is the most influential form of media that exists. Period. That's why Congress tried to control it a few years back. They realized how influential it was when it came to campaigning.
Sure.
And you can get on talk shows like this for nominal fees. People are always surprised at how easily they can engage themselves in a regular talk show here on Chasm. And they always say, gee, I thought it was more expensive than that. And it's not. And in fact, it's a great deal cheaper when you think of the numbers of people you're reaching. People listened to Jack LaLanne because of his personality.
Yeah.
Okay? When it came to exercise, I'm going to use a horrible example, but people listen to Richard Simmons simply because of his personality. You look at the guy and you say, do you want to look like that? But it's his personality that gets the point across.
Exactly.
So he's actually been real good for the exercise industry, in kind of a weird way. But that's my point. So you get to have a personality and you get to be engaging and get your point across at the same time. People remember that more.
Sure.
Ladies, do you have anything further you want to comment on or ask Tom about before we wrap it up?
I think that one of the things as an advanced practice nurse that you touched on, Tom, and that you really honed in on is the health promotion and health prevention portion